Everybody. I hope you all had a good day. And today is the 1754th day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. And today's our guest is Dr. DEEPTI Sharma. She is a BHMS and MD Pediatrics and currently working as an assistant professor in Department of Anatomy at CVM Homeopathic Medical College, Anand, Gujarat. And today's topic is homeopathy in Tourette syndrome. So let's welcome Dr. Deepti Sharma, ma'am, and let's get an valuable insight from her. Over to you, ma'am.
Thank you so much, Dr. Richa. So, before starting, let me just share the PPT. Is it visible?
Yes, ma'am.
Okay. So, starting with Tourette syndrome and what is its management in homeopathy. So, what is Tourette syndrome first? It is a common inherited and childhood onset neuropsychiatric or neurodevelopmental disorder characterized by persistent motor and phonic tics, which are its hallmark. So, it is a common inherited, which means it has a genetic predominance, and it is its onset is in childhood. Basically, the onset is from 4 to 6 years of age, but it can be till 18 years. So, it is basically in the starting of the development, and it is a neuropsychiatric and neurodevelopmental disorder. So neurodevelopmental disorder means while the development of brain, this disorder is characterized. Okay, and it is characterized by motor and phonic tics, which are its hallmarks. So two types of tics, motor and phonic, and both must be present for it to be diagnosed as Tourette syndrome. It is also known as Gilles-de la Tourette syndrome or tics disorder. Gilles-de la Tourette syndrome on the name of the person who identified it, and an estimated of 0.3 to 0.9% of school age children are suffering from Tourette syndrome, and 0.002 to 0.08% of adults have the diagnosis of Tourette syndrome, although few adult epidemiological studies have been done globally. So as I already told, that it is a childhood onset neuropsychiatric disorder. So basically the onset is between 4 to 6 years, but it can be up to 18 years, and 0.3 to 0.9%, that is, it is common, very common in childhood. Now in the starting, I told characterized by persistent motor and phonic or vocal tics. So I have not made you understand about what is tics. So what is tic? A tic is a sudden, rapid, recurrent, non-rhythmic motor movement or vocalization. So it is rapid and occurring on suddenly, and it is non-rhythmic. Means it has a waxing and waning phase. It is not on rhythm. It is not involuntary and occurring again and again. Tics are usually preceded by a premonitory sensation or urge, such as a feeling of tightness, stretch, tension, or itching that is relieved by performing the tic, thereby leading to an urge tic relief cycle. So a premonitory phase comes before the beginning of Tourette syndrome or beginning of a tic, a phase of tic. So it is a type of urge, a type of feeling from the inside. You can call it a mental itch, and there is a tightness or a tension or a stretch like feeling. Thereby a tic occurs. So it is basically involuntary, but means when there is pre-monitoring phase, so we can voluntarily control it. The movements are non-voluntary, but when there is a pre-monitory phase, we can control it. Tics can come and go, and they take a waxing and waning course. So they can come and they can go. So I told you, as I already told you, there are two types of tics: motor tics and vocal tics. The type of motor tics are like head jerking, eye blinking, nose twitching, lip twitching, swallowing, shoulder shrugging, etc. The types of vocal tics, example can be coughing, grunting, sniffing, throat clearing, and repetitive words. So these are type of simple tics. When these are combined, means more than a single tick is combined, means in a particular position, like if there are motor tics and head jerking and eye blinking are combined, it is called complex tic. Whereas when only one type of tic is present, it is known as simple tic. For the diagnosis of Tourette syndrome, there must be both motor tics and vocal tics present. Basically, some people say that there must be two motor tics and one vocal tic that must be present, but only one motor tic and one vocal tic can be taken as a diagnosis. So, it is a neurodevelopmental disorder. What is a neurodevelopmental disorder? These are the disabilities associated primarily with the functioning of the neurological system and brain, resulting from disruptions in early brain development, affecting the formation and organization of neural circuits. So, during the development of brain and neurological system, the disruptions and the things that disturb the development of the brain and the neurological system are called neurodevelopmental disorder. So, according to the American Psychiatric Association DSM-5, these conditions typically manifest in early childhood, usually before children start to school, and can persist into adulthood. So because they are in the developmental phase, so they manifest in early childhood when the child brain is developing and before he or she starts the school, and they may persist till the adulthood. Examples of neurodevelopmental disorders in children include ADHD, ASD, learning disabilities, intellectual disabilities, conduct disorders, cerebral palsy, impairment in vision or hearing, and tic disorders. So, mainly there are many neurodevelopmental disorders, and they have been classified into 6 classes or 6 groups. The first one is intellectual disability, second is communication disorder, also known as developmental language disorder, then is autism spectrum disorder, then is attention deficit hyperactivity disorder, then comes neurodevelopmental motor and vocal disorders, in under which Tourette's or tic disorder comes. And the last one is a specific learning disorder like dyslexia, dyscalculia, etc. So, what are neurodevelopmental, motor, and vocal disorders? So, these are the conditions, the group of conditions which are defined by the incoordination between motor and vocal control. So, these disorders encompass a group of conditions characterized by difficulties in vocal or motor control and coordination due to disruption in development of the nervous system, includes developmental coordination disorder, tic or Tourette disorder, cerebral palsy, apraxia of speech, and stereotypic movement disorder. So basically, there are many conditions that come in the category of neurodevelopmental motor and vocal disorders, among which we are going to learn about the tic or Tourette syndrome today. So as I already told you that this classification comes under the DSM-5 criteria. So DSM-5 criteria, how does DSM-5 criteria describe the Tourette syndrome? So DSM-5, in the DSM-5, Tourette syndrome is given under tic disorder. And there are various categories of tic disorder. The first one is Tourette disorder, which is a very broad term and it includes both motor and vocal disorders. Second is persistent or chronic motor or vocal tic disorder. So this is chronically present and only one motor or motor or phonic can be present. However, in Tourette disorder, both should be present. Next is provisional tic disorder, in which the time period is relatively shorter and it does not qualify the criteria to be called as Tourette syndrome. Then is other specified tic disorder, in which there are conditions resembling the Tourette syndrome, but the time period or certain conditions are not met. And then there are unspecified tic disorder, in which the anomaly is present, which can be diagnosed, but the condition present as tic disorder. So first is Tourette disorder or Tourette syndrome. So both multiple motor and one or more vocal tics have been present at some time during the illness, although not necessarily concurrently. So because it has a waxing and waning phase, means it's come and goes. So but both motor and vocal tics must be present. And the time period, the B part is the tics may wax and wane in frequency but have persistent for more than 1 year since first tick onset. So since the tick started, since the time that the first tick started, it should be persistent for more than a year. So it should be onset should be before 18 years of age. The disturbance is not attributable to the physiological effects of a substance or another medical condition. So first thing is that both motor and vocal tics should be present, and it may wax and wane, means it can have one tick may be present a week ago and now another tick problem is occurring, but it should be present or persist through 1 year, minimum 1 year, and the age of onset should be before 18 years, and there should not be any physiological effect of any substance abuse, or there should not be any other medical condition which explain the persistence of these tics. Second is persistent or chronic motor or vocal tic disorder. So persistent or chronic means it is persistent and chronically occurring. Now there is a term or, it is not written and. So in Tourette syndrome both should be present, but in persistent chronic it can be either motor or vocal. Other things are the same as Tourette syndrome, but the E criteria is different, in which criteria have never been met for Tourette syndrome. That is, the criteria should not have been, he or she should not have been previously diagnosed with Tourette syndrome. In that condition, it will be known as Tourette syndrome only, because once a diagnosis of Tourette syndrome is given, the other diagnosis cannot be given. And the first one, that is single or multiple motor or vocal tics have been present during the illness, but not both motor and vocal. So these two things are different. Other things are same as the Tourette syndrome. And in this we have to specify if there are motor tics only or if there are vocal tics only. Next is provisional tic disorder. In this, the thing is, it is the same as persistent or chronic motor or vocal tic disorder, but here the tics have been persistent for less than a year. So when the criteria for the time period is not met, then we diagnose it as provisional tic disorder and not Tourette syndrome or persistent or chronic tic disorder. In this also, any of the single or multiple motor and vocal tics may be present. So in this, both the Tourette syndrome, things for Tourette syndrome also come, and things for persistent chronic motor or vocal syndrome comes, but the criteria or the time period does not meet. Now, these are the various things that have been mentioned in DSM-5, and how they have been diagnosed. How can we diagnose the Tourette syndrome? Now, what effect does it have on life is another factor why we have to learn about the Tourette syndrome, apart from its epidemiological prevalence. It represents a significant impact of neurodevelopmental impairment affecting various aspects of an individual life, including motor function, social interactions, and psychological well-being. So, various parts of his social and individual life are affected. And secondly, Tourette syndrome occurs more frequently in males, and the male to female ratio is 4:1. So, males have even severe Tourette syndrome, and it occurs frequently in males. And Tourette syndrome has comorbidities also, which includes OCD and attention deficit hyperactivity disorder. So, the intensity or severity, many individuals with mild to moderate severity experience no distress or impairment in functioning and may be even unaware of their tics. But individuals with more severe symptoms generally have more impairment in daily living. But even individuals with moderate or even severe tic disorders may function well. So there can be many things, and the individual lifestyle may not be hampered, or it may be hampered in severe symptoms, or else in moderate symptoms also. But it may not be hampered at all because he may not be aware himself that he is suffering from Tourette syndrome. The presence of a co-occurring condition such as ADHD or OCD can have greater impact on functioning. Less commonly, tics disrupt functioning in daily activities and result in social isolation, interpersonal conflict, peer victimization, inability to work or to go to school, and lower quality of life. So basically, quality of life is the main thing that is affected in Tourette syndrome, because there is conflict and peer victimization, because people say, and that creates an impact on your mental level. The individual also may experience substantial psychological distress. Rare complications of Tourette disorder include physical injuries such as eye injury from hitting oneself in the face, and orthopedic and neurological injury, example disc related to forceful head and neck movement. So there are various type of motor and vocal tics, but several motor tics can be harmful also when they are involuntary and cannot be controlled, or when there is not a pre-monitoring phase, then it may harm very much, as the person may have an intense desire to hit oneself and injure himself or herself. There may be other type of traumatic injuries that can hamper his physical well-being also, apart from his quality of life. So this is from movie Hitchki, where Tourette syndrome has been represented by Rani Mukherjee, and she has both motor and vocal tics present while she is speaking. She has this movement which is seen in this picture, and she produces a sound while teaching. Apart from having Tourette syndrome, she is a very well teacher, very good teacher while having Tourette syndrome. So this is depicted in the movie Hitchki. And the person is Rani Mukherjee, who is representing the patient of Tourette syndrome. Several other films have also depicted Tourette syndrome, including The Front of Flowers, Matchstick Man, and Mage. So everyone has a different story. Every movie has a different story, but the main character have Tourette syndrome in these movies also. Now, what is the pathophysiology of Tourette syndrome? In the first slide, the very first definition, I told you that it is a common inherited. So there is a genetic interaction also. There is a genetic disposition also that is known by the definition. So researchers have used brain scans and genetic studies to understand Tourette syndrome better. There have been, in the brain imaging, there have been children and adults too. The children with Tourette syndrome, the brain activity looks more like adult, and in the adults with Tourette syndrome, the brain activity looks more like child. So there is a difference in that, and basically it may be because of changes in brain cell collections, and possibly these may be affected by genes and the environment in which they are growing or developing. So tics may be caused by problems in brain circuits that control movement, especially in the sensory motor network, which includes parts of the brain called the basal ganglia. So the problems in the brain circuit, especially the basal ganglia, the network is known as sensory motor cortico basal ganglia network. So basically in this there are various theories given for the pathophysiology, but none has been proved. I should tell you beforehand. So there are many theories. One such theory is this theory, in which they say that the brain circuits, basically basal ganglia, is hampered, and it does the controlling movements. The sensory motor network is disturbed, and thus the person cannot automatically stop movements. and thus the tics are produced. So the brain has trouble automatically stopping movements which may lead to tics. However, when the people with Tourette syndrome try to stop a movement voluntarily, they can usually do it. This may be why some people can suppress their tics for short periods. So some persons may also voluntarily suppress the tick desire, or they may suppress the tick episode and stop it voluntarily, but some people cannot. These people who can voluntarily suppress it usually have the premonitory phase. And but the suppressing also comes with some problems. So when people try to suppress their tics, they usually have increased anxiety, they have increased mental itch, they have increased tension and stress, and they have to somehow the episodes of tics, they when they are of longer duration, they start to occur more frequently when they try to suppress the desire for tics. Now, this was the disinhibition model, and this disinhibition models do not explain why the tics comes and go, why they wax and wane, and the premonitory urges that happen before a tic. So, if basal ganglia is disturbed and they have premonitory phase, so why does they have a premonitory phase, and why can they control it if the basal ganglia is disturbed or the circuit is disturbed? So this is the limitation of this pathophysiological theory, which is the first one, which is the disinhibition model. The second is voluntary intentional inhibition model, in which there is a voluntary phase where people inhibit the or suppress the desire for tic, suppress the episode of tic. So in this, there may be two types of inhibition. One is proactive, and then another is reactive inhibition. The proactive inhibition is when there is a premonitory phase, they stop their urge, or they stop their action before the starting of the tic phase. And the reactive inhibition is once the tic has started, they try to suppress or inhibit the tic episode at that moment after it has started. So voluntary or intentional inhibition is of two types, that is proactive inhibition and reactive inhibition. In the proactive inhibition, the person stops a tick before it starts, and in reactive inhibition, once the tick has started, then they try to stop it. People with Tourette syndrome often feel a premonitory urge, a weird feeling of pressure right before a tick. Doing the tick makes the urge go away, which feels like a reward to the brain. So, the premonitory urge that I told you about before. So the feeling that something is about to happen, and the urge to do it. So after doing the things that the person desire, the premonitory urge that there is, the after releasing the tension or the stress that has been built by the premonitory urge, after they do it, it feels like a reward to the brain, and thus this creates a cycle. So it is a loop. You feel an urge, you do a tick, the urge goes away, and your brain gets a little dopamine reward, and this reward system might reinforce or strengthen the tick, making it more likely to happen again, like forming a habit. So when there is increased dopamine, so the brain will automatically feel happy, and it will feel like a reward, and thus the cycle will keep on repeating, and the tick will strengthen. So basically, both the things, even doing the tick or suppressing it, both the things are not good for that person. If they are suppressing it, they are increasing the anxiety, the stress, the tension, and if they are doing it, they are strengthening or reinforcing a trait. So both the things cannot be good for the person that is having a Tourette syndrome. Tics might be reinforced habits supported by increased phasic dopamine release. Reinforcement learning, which is reward based learning, is stronger in Tourette's. People with Tourette's syndrome tend to rely on habits when not on medication. Increased tonic dopamine may boost repeated action like tics due to changes in brain pathways, and tics might remove the urge, create a positive reward that reinforces the tic. So basically, what I have already told you before, that this increased phasic dopamine activity keeps on increasing and it reinforces the tic. However, when on medication, they do not do these habits, but when they are not under the effect of medication, they rely on these habits to increase the production of phasic dopamine, because um, that that desire to have all that feeling of reward. Now, third is the neurological findings. What does the scientific findings say about it? So during a surgery or with brain recording devices, the scientists had found out that the people with Tourette syndrome show a increased low frequency activity in the centromedian thalamus, and low frequency activity is also seen in the anterior pallidum. So in the first theory, it was basal ganglia that was mainly affected, and in this neurophysiological findings, the brain recording devices have showed that there is a low frequency activity in thalamus and pallidum. Now, this low frequency activity may be linked to tics and possibly premonitory urge. So, when there is a low frequency activity, it is possible that these are responsible for the premonitory urges. Now, the etiology. See, pathophysiology we have already understood. Etiology is almost the same. The same things are there. The etiology of Tourette syndrome is complex and involves a combination of genetic, neurobiological, and environmental factors. While the exact cause remains unclear, several key factors contribute to its development. First is genetic factors, as the definition already told. Strong genetic component have been found, familial patterns have been observed, and multiple gene loci linked, but not a single gene has been confirmed to have caused Tourette syndrome. However, I would like to put an emphasis here that some studies have also showed that in a monozygotic or and a dizygotic twin. So, in a monozygotic twin, there is 85% more chances if one person is suffering from Tourette syndrome, the other will also have Tourette syndrome. And in dizygotic twins, there are very less chances, means 7 to 10% chances, 85% in monozygotic and 7 to 10% in dizygotic twins. So basically, here the genetic factor or genetic link is shown, that when the gene component is the same, then there are chances, 85% more chances. And when there is the same genes are there, but there is some difference, then there are considerably low chances. Next is neurotransmitter imbalance. So dopamine, as I have already told you, that the reward is dopamine, and so dopamine dysregulation and changes in dopamine signaling in CSTC circuit, which is responsible for motor control and inhibition. So there are changes in dopamine regulation there, and thus the imbalance is created, and thus these symptoms appear. There are also seen that there are several structural and functional brain abnormalities, as I have already told you, that low frequency in thalamus and pallidum have been shown. There have been sensory motor dysregulation in basal ganglia also. So there are various abnormalities which can be linked with Tourette syndrome. There are various prenatal and perinatal factors also, but the mechanism is still unclear, and the basis for saying that the prenatal and perinatal factors affected are still unclear. So, maternal smoking, pregnancy, delivery complication, and toxic exposure may be linked to it, but they are also linked with other psychiatric disorder. Thus, they are linked with Tourette syndrome also, but the mechanism is not clear how they affect the fetus or how they affect the developing child to have Tourette syndrome. Next is autoimmune and inflammatory process. Some link to autoimmune conditions, elevated inflammatory markers are seen, but this is also not understood clearly, and more research are needed to prove that there are inflammatory or autoimmune processes producing Tourette syndrome. Now, there are various risk factors also that can cause Tourette syndrome. As I have already told, that there is a premonitory phase, there is anxiety, stress, tension. So these things, the anxiety, the stress, the tension, the family dynamics, or any type of stress, the peer stress, or any type of stress may cause a episode of Tourette syndrome. No? So there may be also physical impact, like there is some sort of discomfort, pain, or fatigue, which may cause motor or vocal tics. But there may be psychological effect also, like anxiety, depression, low self-esteem due to visible and misunderstood symptoms. There may be social challenges, like vocal inappropriate tics may draw unwanted attention, risk of teasing, bullying, exclusion, fear of judgment, social anxiety, and which will lead to social anxiety and isolation. Uh, in the movie, I have already told you various movies. So in the movie First Row, the first movie that I told you about, in this the inappropriate tics appear in the child, and he is in front of whole class, and the episode of tick starts, and he is unable to control it. But then also he's able to be a good person in his adult life after coming up out of the fear of judgment. But there was definitely isolation and social anxiety while he was still a child. Next is educational and occupational impact. The tics and social issues affect focus and performance, challenges in school, career, job retention, and possible discrimination. Family dynamics, stress, frustration, financial strain on family, siblings may feel resentment or guilt. So there are various risk factors also, and these are the factors which affect the lives also, the quality of life also in the person already having Tourette syndrome. These are the risk factors for having Tourette syndrome also, and these are the factors which affect a person when he is already having a Tourette syndrome episode. Now, the differential diagnosis. What is the differential diagnosis? You must be saying that for the motor tics, that there is involuntary movement, and various other conditions also have involuntary movement of hands, limbs, and various other body parts. So yes, there are also other conditions where there are abnormal bodily movements, like in motor stereotypies or chorea or dystonia. But these type of conditions do not have a pre-monitoring phase, and they are they are involuntary in every aspect. They do not have a voluntary approach, and in fact they occur on the contrary, they come into effect when voluntary movement is started or initiated. Means when there is a voluntary movement, uh, suddenly the chorea episode occurs. So in Tourette syndrome, where we can voluntarily control it, where there is a premonitory phase. In contrary, in chorea and dystonia and motor stereotypies, there is movement on voluntary movement, right? Yeah, voluntary, any exertion or anything voluntarily doing, and then the episode occurs. In myoclonus, there is only one side is affected, and only one side they are doing the things, and they can be in other parts also. Means the several parts that have been affected, sometimes the legs may be affected, sometimes the hands may be affected. In tics, the person do repeatedly do the same gesture, like blinking of eyes, any other thing also. In obsessive compulsive and related disorders, the thing is In my one more thing, in myoclonus, they start before the age of 3, whereas Tourette syndrome start mainly in the developmental phase and during the school going age, which is 4 years. So in myoclonus, the effect may be seen in while sleeping also, and they are mostly started before the age of 3 years, while Tourette syndrome starts mainly at the age of 4 years to 6 years and can be there till 18 years of age. Now, obsessive compulsive and related disorders, though they can be comorbidly seen with tics disorder or Tourette syndrome, but the difference is obsessive compulsive disorders are mainly goal related. The thing is, they try to do or set up things in particular way because that is their goal. They have to do it that way only. They have to wash hands again and again because they have a set thing in mind that there are germs and thus I have to wash my hands. So this is mainly goal oriented, while the Tourette syndrome is not goal oriented. It is more like a dopamine, a reward system in Tourette syndrome. Now, various treatment strategies have been told. Various strategies have been told for Tourette syndrome, which are first behavioral therapies. These are first line of treatment given. These are first line of treatment that are given. First is CBIT, Comprehensive Behavioral Intervention for Tics. This is most effective non-drug treatment and recommended as first-line therapy, works in both children and adults and as effective as medication in world large trial, and it includes habit reversal training, increased awareness of tics and urges, and completive response training, teaches tic suppression. So it has two phases, that habit reversal training and competing response training. So in this, they tell you how to get more aware about what is happening to you and what you can do to suppress it, and how you can combat it, how you can combat the habit that you have formed. So first one is CBIT, which is Comprehensive Behavioral Intervention for Tics. The alternative for CBIT, where CBIT is unavailable or cannot be given or a counselor is not present, then exposure and response prevention. So it builds a tolerance to urges, and limited evidence is there to support the alternating between the two, and group therapy and telehealth video remote therapy may also help. So what is the difference between CBIT and alternatives? That CBIT includes two things. It increases the awareness and it also teaches you how to suppress the urges, while the other treatment options like in the behavioral therapy, it is how to prevent it, how to build the tolerance for it, and the group therapy is also helpful in some cases. However, not many researchers have proved the uh, importance or of the group therapy and telehealth. Next is pharmacological therapies. What are pharmacological therapies? In which the medications are given. So when first line of treatment is behavioral therapy only, the pharmacological therapies are given when tics are more severe or more urgent, and the behavioral therapy has not proved successful or it has failed, then the pharmacological therapies are used in the allopathic system of medicine. And the type of medicines that are given are alpha 2 agonist, typical and atypical antipsychotics, and anticonvulsants also are given for Tourette syndrome. So you see typical and atypical antipsychotics and anticonvulsants are also given. However, there is already a voluntary phase which can help the patient, but then also antipsychotics and anticonvulsants are given to the patients as a part of pharmacological therapy. Then the very bizarre deep brain stimulation is also given. So for severe treatment resistant cases, deep brain stimulation is given. It is not FDA approved, but it has been used over 300 patients globally. In this, the neurostimulator is placed, and it targets the centromedian thalamus and pallidum, which has low frequency on brain imaging. It has been shown that they have low frequency activity. So via neurostimulator, these areas of brain are stimulated because they have low frequency. Thus, they are stimulated, and thus the results are seen whether it is having a positive effect on Tourette syndrome or not. While this is still under consideration and the researches are going on, but I think it is very bizarre to for the patient to go through such and such interventions while it is just a behavioral or neuropsychiatric disorder. Then also these all things are given to the patients. So for deep brain stimulation or DBS, it is given for severe and treatment resistant cases, and it is not FDA approved but used in over 300 patients globally. It shows tick reduction of 45 to 53% in studies and has mixed results in randomized trials due to small samples. Common brain targets are centromedian thalamus, pallidum, anteromedial and posteroventral, and pallidum DBS may help OCD more. So it has been seen that it has helped OCD. The pallidal deep brain stimulation has helped OCD rather than Tourette syndrome. Now the basic part, the thing that I have been talking in the starting, that homeopathy, how homeopathy can help in Tourette syndrome. As we already know that homeopathy works on the principle of similia similibus currenter, which is like your like. The remedy which is given on the basis of totality of symptoms and individualization may help the patient with Tourette syndrome. As we have seen that allopaths are giving pharmacological therapies which are not proven, and they are antipsychotics and anticonvulsants that they are giving for Tourette syndrome, which are, I don't think that are in any case they can be given, but they are giving that, and they are giving deep brain stimulation therapy. But homeopathy has several remedies that can help the patient with Tourette syndrome. What are these? The different in the different repertories there are rubrics related to Tourette syndrome also. Like this is from synthesis repertory. There is tics nervous. So it is given in mind. The rubric is also given in generalities. So the remedies which are mostly used are agaricus, argentum nitricum, arsenic, bismuth, various hyoscyamus, stramonium, various medicines income, cuprim, they are used. You know? And there are various other rubrics in which it is seen. There are cross references given under which children in there is only single remedy, carcinosin, and painful also, tics may be painful also. So these are a rubric from synthesis repertory. This is also a rubric from synthesis repertory. It was this was for tics, and this was for Tourette syndrome as a whole. And agaricus, hyoscyamus, opium, stramonium, various remedies are given, and cross references to these are also given. This is also given in synthesis repertory itself. And this is from Fatak repertory. And this rubric is from Boric, and it is given in nervous system, the chapter nervous system. Tic convulsive, argentum nitricum, hyoscyamus, lauracerasus, lycopodium, CPR, tarantula, zinc, many remedies. So there are few remedies which are of great importance. We know these basic remedies automatically come in our mind when we talk about the Tourette syndrome or the involuntary movements or movements of any sort, especially motor tics. When we talk about agaricus muscarius comes into our mind on the first instance. What other medicines comes in our mind on the first instance are cuprum, and zinc. So agaricus muscarius is especially used for motor tics. Twitching and trembling are the main indicative features in cases where there are marked motor tics like eye and facial twitching, shaking of legs, jerking of the hand, etc. Twitching typically stops during sleep, trembling sensation in the lips and lower jaw area, So basically, Agaricus muscarius is basically used for twitching and trembling, है ना? And it works greatly in children and in the hyperactivity and clumsiness. Also, it works great. So Agaricus muscarius for motor tics mainly. Stramonium is indicated for vocal tics, as we know. There is stammering that is present in stramonium. So the involuntary use of larynx, the stramonium is the remedy. Next is hyoscyamus niger. So there may be obscene gesture which are involuntary, and patient may represent it like that, and involuntary grimace and ridiculous gestures may be present, and in the such cases hyoscyamus niger is given to the person. The cuprum mat, best for eyelid twitching, eyeball rotate quickly behind closed lids and roll from side to side, distorted face and chewing motion of the lower jaw, constant protrusion and retraction of the tongue like a snake, hiccup preceding the scar, cramps and convulsions beginning in toes and fingers. Argentum nitricum, which is suited to impulsive and hurried person, and it is helpful where trembling of hands is there, trembling of legs is there is unsteady walking and impulsiveness along with the desire for sweets. Agnatia mara is best adapted to oversensitive and nervous person, and there are hysterical attitudes of the person along with twitching of muscles of face and lips and spasmodic clenching of the jaws, and the emotions bring on the symptoms. The lycopodium is indicated in the twitching of face and mouth and occurs when tired or stressed. They have low confidence level and they are emotional and weeps all days. They are also stammering and the speech is indistinct. Zincum metallicum, it's best suited to the person suffering from cerebral and nervous exhaustion. This medicine plays an essential role in muscle control and coordination. There is automatic motion of hands and head on one hand, or one hand and head. Twitching and jerking of single muscle. Fidgeting of lower extremity is also used when the child repeats everything said to him. Nervous motion of feet when asleep. Loud screaming out at night and sleep without being aware. All in all, I want to put emphasis on that mainly the remedies that are used for Tourette syndrome or basically tics are of mineral kingdom origin. I think magnesium group is also of great help in the Tourette syndrome. The zincum metallicum, as we have already studied, the cuprum mat, argentum nitricum, all comes from the mineral kingdom. And I think mineral kingdom remedies are basically very good in cases of Tourette syndrome. It may be because of the deficiency it can overcome, or it may be because it has great impact on the neurodevelopmental level. So on my personal thinking is that mineral kingdom is of great help in the Tourette syndrome. That's all. Thank you. I am open for any questions there are. Or if anything I have to tell again that have not been understood as of now.
Yes,
Hello,
Dr.
sir.
DEEPTI Sharma, it's really a very good session. You really
Yes, sir.
rocked the session with your knowledge, and your presentation was really top class. And we never thought of such a syndrome before, because we as homeopathic doctors usually stick on with uh, our materia medica and the patient in front of us. The diagnostic part sometimes we miss, and unfortunately, we are not going in that depth. But when patients coming from the other side, they used to come with the diagnosis, and then only we will be able to know, oh, this is a specific syndrome. So then we will refer it and study it. So this kind of presentation really a boost to us.
Thank you
And
so much.
and the last part you covered some of the medicinal part also. That's a very very important thing. And it's the time for discussion. And those who want to participate in discussion may please raise your hand so that you can talk to Dr. Deepti Sharma. She has made some presentation earlier also. Dr. Richa Mavedya, please come forward.
Yes, sir.
Yes, yes.
Yes, sir. Actually, I am a little bit not well. So
Okay.
my voice, as you can
No,
hear, it's hoarseness is there. So
no problem. These are
yes,
this can be happen to anyone at any times. It's
sir.
our duty to come. But it's here it is the time for fever to most of the people because the time is a rainy season in South India.
Yes.
What about in your part also?
Sorry,
Whether
sir. Yes,
whether there is a heavy rain in Gujarat
yes,
now?
sir.
It is
Yes,
very
sir.
heavy
Since
rain in
last
Gujarat right
2 days,
now.
Okay.
someone.
If we can invite Dr. Rambaresh sir to say a few words.
Yeah,
Please unmute,
before
sir.
starting the question and answer round, I would also like to add that since I was saying in from the starting that Tourette syndrome, there is so much stress, there is tension, there is internal itch, right? So, what basically miasm can we say it has? So, SORA is the main miasm that it has. Tourette syndrome can be called as having SORA mainly miasm, but other miasm also it is complicated with other miasm also, but basically there is SORA because there is so much internal tension and stress, and there is internal itch that is present, the mental itch, the urges that they have for that. I think so.
Oh, thank you, Dr. Dhanesh ji, and everyone. Namaskar, congratulations, Dr. Deepti Sharma.
Thank you, sir.
Great presentation. Tourette syndrome. Tourette syndrome, the very difficult beginning child to. So, cause of Tourette syndrome, motor tics and vocal tics.
Yes.
Vocal tics and vocal tics. And cause of syndrome is the, according to presentation webinar, Dr. Deepti Sharma, very good deals. Cause, genetic cause, main genetic cause.
Yes, mainly there
What?
is
Genetic cause. And second, neurological cause, neurochemical cause. So,
yes.
है ना, neurochemical cause. And third जो है fear, anxiety, etc. And guilt in child age. So trauma, a kinds of trauma, child age. So very thanks, doctor. And background of SORA, the actually, like without SORA,
Nothing else can be
mother of
present.
all diseases, SORA, है ना?
Yes.
तो बैकग्राउंड SORA, थिंकिंग ही SORA है ना? सोच ही SORA है, और जैसा सोचेंगे वैसा होगा. तो very thanks, Dr. Deepti Sharma.
Thank you, sir.
Thank you.
If anyone wants to have a chat, you can open your video or you can raise your hand so that we will allow you to ask the question, or we can make your statement here. Doctor, what kind of cases you are getting regularly? Whether all these psychiatric cases or neurological cases?
So mainly there are pediatric cases that I'm handling since I am MD in homeopathic pediatrics. So
Okay.
psychiatric cases are less in number because people don't know that children are suffering from such and such disorder. But yes, there are a number of cases of psychiatric origin, and persons are coming, and they are of getting clinical attention also, but mainly there are other seasonal disorders or worm infestations or etc. The chronic skin diseases they are present, But psychiatric disorder, mainly behavioral and eating disorders, we are getting in our OPD.
Okay, well, whether you are more concentrating on learning disability, because learning disability is one of the area where homeopathy can do wonders. What kind of success rate you people are getting there? Whether you are dealing with such cases, whether you are doing any such research in schools, whether you are doing any surveys or taking any such research methodology to schools, so that we can. And give the services of homeopathy for the students who are suffering from learning disability and learning problems.
So, for psychiatric disorders, sir?
No, learning disability, as we all know that
Learning
learning
disabilities,
disability
yes, sir.
and
One of my colleague herself did a research on learning disabilities, and she took a broad topic of specific learning disorders. It included all dyscalculia, dyslexia, and everything. So she did a research on it, and it has shown wonderful results. However, there are not main in writing skills, they have not improved much, but the vocational skills of the person and the concentration abilities, I think they have shown wonderful result in that research that she did. She was my
yes,
colleague in MD.
yes, in our Kerala, in the government sector, there is a special branch for this, and they are doing excellent job in doing this learning problems. There are a specific program for students, and almost all students who are suffering from these learning problems as well as learning disabilities are brought to homeopathic hospitals, where we are able to give better treatment, and the results are fantastic. And now people are getting this kind of knowledge that homeopathy can do such services to students also in that respect. However, this kind of programs are going on in your state as well as in your schools. Otherwise, you people can give this kind of notices to, or you can ask them to follow the Kerala model to implement in the government sector, so that more and more homeopathic doctors will get jobs in that area also.
Definitely, sir. More can be done in these cases. And the thing is that in allopathy, these cases are termed as incurable, whereas in homeopathy, they are showing wonderful results. So, this is the thing where homeopathy can outshine the other system of medicines. So, yes, we should do much more about it.
Exactly. We as homeopaths can do lot of good thing for this kind of problems which they are facing.
Mm.
I'm
Right.
inviting Rambara Sasa to say vote of thanks to the session also.
Thank you, Dr. DEEPTI Sharma.
Thank you, sir.
Very good presentation and medicine and curative. Only homeopathic medicine, homeopathic treatment, you're the Tourette syndrome.
Yes.
There are 3, 4, 5, yani constitutional treatment, and tarantula is a very good remedy.
Yes.
And ginkgum metallicum, very good remedy. Hyosamas, very good remedy. है ना? Vocal and motor, motor tics. So, very, very thanks behalf of IFPH whole team. Very, very thanks. Again, presentation. Thank you. Very, very thanks.
Thank you, sir.
Thank you, Rambara sir, and Dr. DP Sharma and Dr. Ticha Mavedia for moderation on the same, as well as those who attend the session in this evening. Hope you, Dr. DP Sharma, can do some more presentation in the coming edition of our sessions. Thank you all. Thank you all. Good night. Tomorrow we will have a session from Dr. Pankaj. Dr. Pankaj is also an MD, and he is The subject of discussion will be a series of evidence-based case studies on the evaluation and the individualized homeopathic treatment for Verruca vulgaris. So that is the session for tomorrow. Dr. Pankaj is working as associate professor in Homeopathic Medical College. Okay. Thank you all. It's over to Dr. P. Shailat to moderate the Malayalam session.